Hi, we're going to talk about the phases of tooth eruption. Now, what is tooth eruption? Eruption is a process by which a tooth moves in the development position of the jaws to the functional position in the oral cavity. It involves the tooth moving through the bone and oral mucosa to reach the occlusal plane. These movements are classified into three phases: pre-eruptive, eruptive, and post-eruptive. Pre-eruptive phase is the phase when the tooth germs move within the jaws before the root formation. When the deciduous tooth germs first differentiate, they are extremely small and a good deal of space is available for them in the developing jaw due to their rapid growth. Crowding results. This crowding is then relieved by the growth of the jaws in length, which permits the drifting of the tooth germs. The tooth germs grow and move in relation to the growth of the jaws in length, width, and height. Lengthening of jaws help in anterior tooth germs to move forward or mesially, and molar tooth germs to move backward or distally. Simultaneously, the growth in width and height move the tooth germs outward or buccally, and upward in the case of mandible, or downward in the case of maxilla, which is occlusally. Permanent tooth germs also move in relation to the primary tooth germs. Initially, in the same bony crypt, permanent tooth germs lie lingual to their deciduous predecessors and are on the same occlusal plane. Then it is situated in their own bony crypt beneath the divergent roots of the deciduous molars. The permanent molars, however, do not have a primary predecessor. The permanent maxillary molars develop in the maxillary tuberosity that are positioned with their occlusal surfaces are tilted distally, and permanent mandibular molars develop in the base of the mandibular ramus with their occlusal surfaces are tilted mesially. Permanent molars are positioned this way for want of space. When the jaws grow sufficiently, permanent molars are positioned vertically. The pre-eruptive movements of teeth are a combination of two factors. The first is the total bodily movement of the tooth germ, which in a mesial direction, a bone resorption occurs on the mesial surface of the crypt wall, and a bone disposition occurs on the distal wall. The second factor is the eccentric growth, where bony remodeling of the crypt helps in accommodating the growth of the tooth. This growth explains how the deciduous incisors maintain their position relative to the oral mucosa as the jaws increase in height. Eruptive phase, or the functional eruptive phase, is when the tooth moves in an occlusal or axial direction from its position in the crypt to appear in the oral cavity in functional occlusion position. The phase begins with the initiation of root formation when the growth of Hertwig's epithelial root sheath begins the differentiation of odontoblasts from the dental papilla. The periodontal ligament, or the PDL, develops only after the root formation has been initiated. Initially, a bundle of periodontal ligament fibers appear at the cervical area of the tooth root and extend at an angle coronal to the bone. As the tooth erupts and starts to elongate, periodontal ligament fibers become more prominent and attach with the root on one side and the bone on the other. Bone removal is necessary for permanent teeth to erupt. In case of those teeth with deciduous predecessor, there is an additional anatomical feature, the gubernacular canal and the gubernacular cord, which may have influence in the tooth eruptive movement. The gubernacular cord is a strand of fibrous connective tissue containing the remnants of dental lamina. They can be identified in the jaws on the lingual aspects of deciduous teeth. The canal housing is called the gubernacular canal, and it is widened by the osteoclast to guide the permanent teeth to erupt. Finally, periodontal ligament fibers are established at the apex between the socket floor and the root tip. After removal of any overlying bone, there is a loss of connective tissue between the reduced enamel epithelium covering the crown of the tooth and the overlying oral epithelium. The epithelium begins to proliferate and migrate into disorganized connective tissue. The central cells degenerate and form an epithelium-lined canal through which the tooth erupts without any bleeding. The epithelial cell mass is involved in the formation of dental-gingival junction. Once the tooth has broken through the oral mucosa, it continues to erupt at a rate about 1 mm every 1 to 2 months until it reaches the occlusal plane and meets the antagonist of the opposite arch.
Next up, we have the post-eruptive phase. The post-eruptive phase occurs once the teeth reach functional occlusion within the oral cavity. This phase reaches its peak during 14 to 18 years of age, and it is closely associated with condylar growth. However, the post-eruptive phase continues as long as the tooth remains within the oral cavity. The movements that occur during this phase are axial and slightly proximal and occlusal. The axial movements functions to keep up with the increased jaw height. These movements end once jaw growth stops. These movements also help keep the teeth in position despite the wearing away of tooth surfaces, specifically at the proximal and occlusal surfaces of the teeth. When there is too much occlusal wear, there will be excess cemental deposition at the apex of the tooth, which will be accompanying the occlusal movement to compensate for the attrition. However, there is no evidence that this cemental deposition is the cause for tooth movement. It is more likely that the forces that bring about tooth eruption are still available to bring about sufficient movement of the tooth to compensate for occlusal wear. Bone formation in a ladder-like pattern can be seen at the fundus of the tooth. This particular bone formation helps stabilize the tooth during tooth eruption. When the teeth are brought together for occlusion, an anterior directed force is generated, and this accounts for the mesial drifting of teeth. Histologically, this drift is considered a selective deposition and reabsorption of bone on the socket walls of osteoblasts and osteoclasts respectively.